Welcome to Better Health for a Better World, a dedicated podcast series that shines a spotlight on global health projects and programmes supported by the Government of Ireland across partner countries in the Global South. I'm your host, Nadine Ferris-France, and together we'll embark on a journey to explore the remarkable initiatives transforming lives and communities around the globe. This podcast aligns with Ireland's international policy document, A Better World, which serves as a framework for our discussions. Each episode will feature interviews with one or two speakers who are at the forefront of implementation. Get ready to be inspired by the incredible changemakers working tirelessly to build a healthier and more equitable world. Welcome back to Better Health for a Better World. In this episode, we are heading to Mozambique to explore the important topic of maternal and child health with a focus on HIV and the challenges that remain in these areas. The guests will also spotlight the work that is being done to increase access to services for everyone, particularly the harder to reach populations. Today, we're absolutely delighted to be joined by three guests for this episode. Patrick Empey, who is Ireland's ambassador to Mozambique. Patrick, absolutely super to have you on this programme and to see you again.
Thank you, Nadine.
He is joined by Biatriz Rocha, who is the Programmes Director for Maternal, Newborn and Child Health at Clinton Health Access Initiative, CHI, in Mozambique. Welcome, Biatriz.
Thank you, Nadine.
And last but not least, Chishamiso Mudenyanga, who is also from CHI in Mozambique, and he's heading up the HIV and AIDS programs as Programs Director. So you're all very, very welcome today. And I think I might just kick off with yourself, Patrick, if I can, and just ask, as I've asked other ambassadors on this program, just to share a little bit around the background of Irish Aid's work in Mozambique, the history of collaboration, just a little bit more about the partnership. Over to you, Patrick.
Thanks, Nadine. And once again, thanks for this opportunity to be able to speak about Mozambique and one of our most central partners here in one of our most central areas of intervention in Mozambique. But yes, in terms of our history, I have a little knowledge of that because I was here when we initiated our program in 1996. And that came about because of the expansion in ODA budgets by the government at that time. And Ethiopia, Uganda, I think, had been opened a year or two earlier. But then in 1995, the government chose to invest in Mozambique. At that time, it was either going to be Somalia or Mozambique. The government decision was made in 1995, and myself and another colleague arrived here in September 96 and initiated the first planning, finding the offices, etc. That's now, last year we celebrated 25 years of programming in Mozambique, and I think there's quite a history of engagement there to build upon. And in those beginning of that period, health and education were quickly identified as central areas. And I'm glad to say that 25 years later, 26 years later, we've shown stamina and stayed in those sectors. But also today, we're more involved in obviously humanitarian because Mozambique, unfortunately, is prone to cyclones and climate change. Humanitarian, also there's been a peace process here that with a lot of interplay between Mozambique's experience and that of Ireland. So we're quite prominent to that area and along with governance. Our budget at the moment is about 27 million a year, with health being by far the largest component of that. And our relationships with Mozambique are much more than the development cooperation, but I know that's an important part of that relationship. And this last July, we had the pleasure of having the Taoiseach, Micheál Martin, visit us for 3 days, and perhaps we can speak a little about that later on, because he had the opportunity to see some of Shai's work in one of our provinces. I saw firsthand the work that we and the Clinton Health Access Initiative does in these areas. But that's the history. We're certainly now at the stage of starting to prepare our next 5-year planning, 25 to 2029. I won't preempt what will be that plan at this stage, but certainly I would be confident that this area that we work in will be part of our next strategy.
Thank you, Patrick. Yeah, that's a really, really interesting just to set the context, and also quite incredible that you were there 25 years as the embassy was set up and then come back as the ambassador. So an interesting journey for sure.
One of the things that was interesting about Mozambique, it was the first time Ireland opened a country program or a bilateral program where we had no previous relationships. We had no sort of relationships with missionaries, for instance, to set up. So when we arrived, it was very much sort of an exploration, try and see. And one of the first challenges we had was to distinguish Ireland from Iceland. The conclusion was quite
well, hopefully 25 years on, you've done that. You've succeeded in that. Biatriz, I might come over to you. As a programs director for CHI programs, particularly in relation to maternal child health. I know that although there's been vast improvement in maternal mortality and child health, Mozambique continues to have high rates of maternal mortality and HIV. In this context, what are the biggest challenges that women are still facing?
Thank you for having me again. And yes, so we have had significant gains in maternal mortality in the past 20 years, from 2000 to 2020. The most recent challenges we've had in trying to achieve the SDGs, we can say would be the COVID-19 for the past 2.5 years. And that created a situation where the whole system of going to the health facility for care was a little bit interrupted, and the frequency of visits were reduced, and it affected a little bit negatively the institutional births as well, which is something that we are trying to achieve, right? At this point, we are at 67%, and I think we're trying to get close to 80% by 2030. The other challenges as well are access. So most of the women live in rural areas. The government of Mozambique has built primary healthcare facilities across the country and trying to access the women that are in the last mile, let's say, in the most rural areas. But obviously the services provided at that level are basic. So for maternal mortality, we have to also focus on the high-risk women. And that's about 10% of the pregnancies. And so if we can't offer all the specialized care at the primary health level, we should be focusing on how we refer women to district hospitals or vocational hospitals as well, and that there they can get specialized care. And I think that's one of the challenges that the Mozambique government has right now. And we're helping and supporting in that area and trying to see if we can tackle the first cause of maternal mortality in Mozambique, which is preeclampsia, and having early diagnosis at the primary health care facility, and make sure that they get to a tertiary care within a time frame that allows them to save the mother and baby.
Yeah, thank you, Biatriz. Thanks for that. Just a kind of an overview of some of those some of the key issues. Patrick, I might just come back to you just on I think you were in Ireland at the time when A Better World was being developed. It's the Irish Aid strategy, and obviously gender equality is one of the key. It's one of the 4 pillars of that strategy. Now in Mozambique and working with partners, how have you been able to see that policy being implemented in reality, in the support to partners and the different initiatives, some of which Biatriz has mentioned there around maternal child health? I know also there's some work on gender-based violence, education and training of women and girls. Yeah, a little bit about how the policy has been implemented.
Thanks, Nadine. As I mentioned, health is a major component of our expenditure here in Mozambique, our areas of investment. And A Better World, as your listeners or many of your listeners know, prioritizes universal health coverage, and particularly then in relation to maternal and neonatal care, SRHR, but also health system strengthening and ACT service and the quality service delivery. So, our approach here in Mozambique has got a number of layers. As you possibly know, we're a founding member of the Global Fund for TB, AIDS, and Malaria, and we are significant contributors to that organisation still. And their funding comes in for those 3 communicable diseases and in health system strengthening. In Maputo and Mozambique ourselves, we support the national health strategy, by providing what we call program funding direct to the Ministry of Health. And that's, along with a number of donors, we fund right across the country, about 80% of those funds going straight to the district level, covering training, some salaries, but the provision of maternal and child health care. And that's fully aligned with the government's priorities, which I think number 2 is maternal and neonatal care. But we also work with a number of other partners. David Wheatley from the HSE. We have a partnership here with the HSE working on quality services at the hospital level. And critically, we have a relationship that we're extremely proud of with Clinton Health Access Initiative. And that's a partnership that goes back to 2003, 2004. And I think Dane will speak to that a little bit further. But one of the reasons we're so proud of that relationship is that they work very closely with the government and the Ministry of Health, and very much in terms of capacity building, health system strengthening, and have done some wonderful work in relation to innovation, research and innovation, low-cost technologies, particularly initially in the area of HIV and AIDS, and more recently in terms of preeclampsia, etc. But I think we'll talk about that a bit further, Nadine. But our support and our delivery of A Better World is done through these and a couple of other partners, which perhaps we don't have time to go into now in the area of health, so we're in health services.
Thank you, Patrick. Chishamiso, maybe coming over to yourself in terms of how, the specific initiatives that CHI is involved in, particularly in relation to HIV, because I know CHI has been a significant partner of Irish Aid, as Patrick mentioned. Can you tell us a little bit about the work on HIV and what currently are, remain to be challenges, and what kind of strategies is CHI implementing to try and meet those challenges?
Yeah, thank you, Nadine. To respond to your question, maybe a bit of background to Mozambique's HIV situation would help define or maybe make one understand the initiatives that CHI has taken in the HIV space. We got enrolled in the HIV area when treatment was not readily available. Testing of affected children was also very low. And at the time, I think some of the children would even die before they get their results. And so there was a need to address the gaps that were existing at that time. And the primary gap at that time was to try and improve the testing of HIV-exposed children. And what CHI did, we introduced point-of-care platforms, which were the very first, Mozambique was the very first country to do the evaluation of these platforms and subsequently scale them up at national level. And that led to the WHO ultimately highly recommending the use of the same. So this initiative enabled us to first of all, decentralize testing to the very remote settings where very limited training was required to enable healthcare workers to conduct testing for these affected children, identify them and initiate treatment of them on the very same day, thus reducing the risk of losing children in the treatment and HIV care cascade. Secondly, we also managed to bring the same platform to address to the high demand for viral load testing, which is key to addressing the risk of transmission of HIV to the children, mother-to-child transmission. And that would then enable clinicians to be able to test a mother on the same day and be able to offer treatment adherence counseling if it was needed. And these approaches, they are all very essential to addressing vertical transmission, as well as identifying children early and maintaining them on treatment. And we have seen these programs being scaled up nationally, and the impact is quite significant. For example, before we introduced this point of care, our coverage for the HIV-exposed children who were being tested before they turned 2 months was as low as 43%. But then when we brought in these technologies from 2016 to date, we see that coverage for children exposed to HIV who are being tested before they turn 2 months is now at 94%. So these are some of the huge gains we have seen with these interventions that are addressing the HIV needs among exposed children. Thank you.
Yeah, thank you. Thank you. And, I wonder if you could say a little bit about the challenges. Obviously, the landscape with HIV has shifted enormously over the past 20 years with treatment and some of the great initiatives you've just mentioned there. Obviously run by the Ministry of Health with support from organizations like CHI. What about some of the challenges? I know, for instance, challenges like stigma. How prevalent does HIV stigma? Is it still an issue? Access to healthcare. How does it work? We're talking about Maputo. How about in the rural areas? Are there still some big challenges there with access?
So our approach has actually enabled decentralization of testing and improved access. I mean, our name says it all, Clinton Health Access Initiative. So we are always initiating access. And our majority of health facilities that have benefited from this initiative, they are actually in the rural areas, in the remote settings. They are primary health facilities. They're not even hospital levels. And that on its own addresses the gap that was existing before. But the challenges obviously do remain because this initiative on its own, it enables to improve diagnosis and maybe linkage to treatment and subsequent retention in care. But there is other psychosocial factors that we cannot address through this initiative. And one of the most outstanding one, like you have said, is the stigma, which leads to non-disclosure of HIV status, especially among the affected women. And that does not only affect them, it affects their child as well, because there is no freedom from the infected mother to be able to give treatment to their child or take treatment for themselves because they have not yet disclosed the HIV status to their partner. And one of the studies that we also conducted in Mozambique, also funded by the Embassy of Ireland, looked at how we can introduce very early testing of babies born to HIV-infected mothers, and subsequently initiate them on treatment at a very early stage before they even turn a month old. And one of the main challenges with this approach was we found that the highest risk of transmission was associated with mothers who were infected, but their partner did not know that they were infected. And so the lack of disclosure actually poses a huge challenge on taking of medications and giving of medications to the child. And this is an area that there's still some attempts to try and address this through the psychosocial support system that exists at the health facilities, which we hope can be able to resolve this. You may be aware Mozambique has got a very strong mother-to-mother program, which is also geared to enabling these conversations with affected mothers so that they can disclose their status and subsequently make it easy to take medication and give medication to their children.
I was just wondering, could I ask, have you seen change in sort of the gender aspects of HIV over the 20 years or so? My understanding, the prevalence rate, the estimate is around 11.5%, but for women, it is almost 18%. For men, it's 8 or 9%. I wonder, have you seen any shift or change in the years in terms of those aspects here?
I think it has changed, but it's still higher in women. And for example, in adolescent girls between 13 and 17 years old, it is 4 times higher than the same counterparts in boys. So we're looking at 6.2% in young girls that are between 13 and 17 years, and about 1.8 for boys. And I think that also links a little bit to the fact that at that age, as you know, we have a lot of premature marriages in country. And so they are getting married to older men and possibly already HIV positive. So in that specific age category, the young girls are much more teenagers.
Yeah, there is also the health seeking behavior, right? Women tend to seek health care services more than men, because men, they tend to be busy. They don't go to health facilities, which is one of the reasons why current initiatives are to try and see if health facilities can be open for much longer beyond the normal 3:30. I think that has been done in Chimoyo at the moment, and also suggestions to have some of these health facilities open on weekends is to try and get men to test. So that could be another contributing factor.
It also could be that PMTCT, the Prevention of Marriage to Child program, has done a good job. It's good implementation where we have a high rate of teenage pregnancy. So we have about 46% of teenage girls being pregnant up to the age of 19. So when they come to the antenatal care services, they have to be tested for HIV. And then maybe that's why we also have the data that shows that they're positive, and not so much for the boys.
Mm-hmm. Interesting. It's just, this conversation is interesting. It's like the nuances within, you look at HIV, and on first glance, you can look at something and make an assumption. It's like, oh, there's the data, and that means that. And the question is, but what else? What else is underneath? What other factors could be influencing that? And all of this in great efforts to be able to provide support where it's most needed. Biatriz, I might just ask you, we talk a lot in this series in the various countries that we've been speaking to about partnership. And I've already heard you mention, your partnership with the Ministry of Health, with different, I know that you'll be working with many civil society organizations. Can you say a little bit about the importance of partnerships and collaborations, particularly improving maternal child health?
Well, I think it's very important. It has to happen. We can't do everything ourselves, and different organizations, are able and have expertise in different areas. And so I think collaborating. In the end, we have the one patient, the one person coming to the health facility will need several services, be it at the community level, be it at the health facility level. So if our strength, like Shami is how we call Chishamiso, if our strength is on diagnostics, innovations in diagnostics, there will be another partner who would possibly be procuring the medicines. So we have to be engaging with them in terms of if we are increasing our diagnosis of certain diseases like HIV or preeclampsia or pediatric cancer, they will have somebody else that should be working, such as the Global Fund or Alanic, about forecasting medicines, because we will need more once we get the treatment. There are other partners that do community engagement that work with community health workers, and they will be doing education at the community level to try and get people aware of what diseases look like, when they should be coming to the health facility, what type of testing they should be doing, adherence to treatment, like Shami once again said that adherence is very important. In the past, under different grants, we helped the Ministry of Health to create like a third-party contractor with companies. I'm not going to name now which one of the private sector it was, but they had the expertise on how to make efficient routes to be able to get medicine to the last mile. And so we were able to engage with them and have them be outsourcing this for the ministry. So the Ministry of Health wouldn't have to be thinking about transportation, shipment of medicines, and how to get it to the health facilities. And so it was like a very well-oiled machine, because the private sector knew exactly how to get the difficult road infrastructures and everything. And then it was handed over to the government. So there it goes to sustainability. The government was able to continue that third-party outsourcing. Other areas that we are also looking for is, for example, seeing if there is a private sector that could maybe, and this has to be done with the government, be taxed and then use some of those taxes for the resources in health care that are needed, maybe medicines or treatments that might be needed in relation to some diseases, especially those emerging diseases right now. And also looking at, for example, what we can do as we also generate waste. We also generate plastic into the ocean, into landfills, etc. So we, as a low-resource country, also need to take action and step up, not just wait for maybe bigger global emission countries to do their part. And so looking to see how we can maybe have some recycling of single-use plastics, for example, and if this could be used to produce items that could be used in healthcare. And this would not only include plastic, it could also include medical waste. Obviously, it is an idea that needs to be sorted and stuff, but looking at how companies already do this for profit and how they could support the government in helping with their needs and closing in some of the gaps that they have in healthcare, be it in infrastructure or consumables. And so, yes, we do work with different partners in Mozambique and also at the global level to try and provide a holistic approach to health.
Mm. And Biatriz, just as a woman in Mozambique yourself, I mean, what were your and you know, as you said, you mentioned as we were talking before this began, you know, the office there has quite a big staff. What would your aspirations be if you were really looking for change, particularly in this area of maternal child health? What would you wish to see?
Oh, well, like you mentioned, in terms of collaboration, I think that with the global actors, everybody really understands that they need to prioritize reducing maternal mortality, neonatal health. But I think that sometimes we need it to be more rapid and more flexible in terms of getting boots to the ground. And so a lot of the discussions and the planning needs to be there, but then we need to be able to bring it to where it's needed in a more efficient and rampant way. And I think that that's important. And I also think that we should somehow, in a way, remember that we're not just talking about data or numbers, we're talking about people. And like you said, as a woman, it can happen to me, just like it can happen to someone in an industrialized country, as it can happen to someone in a rural setting in sub-Saharan Africa. So I think we shouldn't lose sight of that there's a person there and that the need is for that person and the value of people, wherever they might be, in terms of accessing help.
Mm. Yeah, thank you, Biatriz. Patrick, I might just come back to you just to ask you, you know, as ambassador, it's a huge program, as you said, it's one of the biggest, covering many different areas and health being among the biggest. Anything in particular that you're proud of during your time that you've seen, partners you've worked with, initiatives that you've supported? And I totally appreciate it's a very difficult question.
I suppose first, we've been talking about some of the challenges that exist in Mozambique, but I think it's worth remembering maybe where Mozambique was and where it's come to, you know, at some of those challenges. So when Ireland started investing in Mozambique first, I think the life expectancy was 42 or 43, 95, 96, and now it's just under 60. And that's a significant one significant indicator of change. But there are others. I mean, Mozambique did a tremendous response, way above the regional average in terms of COVID, and Chai played a very important role in that. So it's not that Mozambique isn't without a positive and constructive story to tell. It most definitely has. But that's not to undermine or underestimate the challenges that exist. You've already talked about the HIV rates. I think maternal death is still about 28. 289. And others. More than half the country is more than 1 hour from a health center. The coverage is very poor. And I think the coverage of doctor population ratio is about 0.09, something like that. Yeah. And in Ireland, it's 40. So the challenges are significant. Let's not underestimate, many of the achievements. And one of those big challenges is population growth. I really can't know one figure that I'm very familiar with in the education sector. And we started first investing in education. It was teacher ratio, pupil ratio was 65. Today, the ratio is about 65. However, the population when it was there was 10.7. Now it's 33 million. So, that's just another indicator, I think, of Mozambique, running hard to stand still, but nevertheless, running hard. So what are we proud of? I certainly would feel that our investment in health sector, despite those challenges, there are things that we started some very simple programs, very simple infrastructure projects back in 95, 96. I can take the hospital in the Chinga, northern province, right at the end of the end of the country, when there were no mattresses on the bed, or there was blood on the floor, there was no protective equipment. And today that provincial hospital has 4 out of 5 surgery operational. I think they've got 12 doctors in it. Ireland itself supported the mid-level training college for the provincial services. Since then, since 97, 98, that's produced more than 2,000 mid-level technicians for the northern province. Small but significant changes, but to see those and to see how Mozambique has invested our money didn't contribute to more of those by any sense of imagination, but it complemented support given to Mozambique and decisions and investments they make themselves. Yeah. So I think there are areas like that. Without a doubt, we're great to be here with Clinton Health Access Initiative, CHI, but without it, that we're a partner since 2003, 2004, and the achievements that they have made, we like to align ourselves very, very much with it. Yeah, so those are amongst some of the things that we're most pleased with.
Yeah, thank you, Patrick. Chishamiso, I might come back to you just as we kind of conclude, as we come to the end of this conversation. I might just come to you and ask you, if you had a message that you would like to convey to the listeners of this series. There'll be likely to be listeners who are passionate about global health in Ireland, in Mozambique, in other countries. What would your message be about creating a better world?
Thank you for that question. So I would probably start with where we have come from, to just encourage the listeners that when efforts are intentionally directed to problem areas and we work in unison with the different partners, not one man on their own, but as a joint team, we definitely can achieve a lot of progress in our attempts. I think at one time, HIV was considered as a disease that was going to wipe out the universe. Today, we are sitting with people that have been infected by HIV and they're living normal lives for over 10 years, 15 years. And that is thanks to the support that the donor community brings into countries like Mozambique, and the evidence of life speaks volumes to itself of the value of the investment. Secondly, we have also realized that success in the health system is not only through what we do with medication or diagnosis, but also if we can build the healthcare workforce capacity that is competent to sustain the gains of the different interventions that we bring into the country. That's the key to sustainability. but our victories or our successes on their own do not necessarily mean that we can relax and celebrate our victories. But I think we have seen a significant evolution in terms of diseases globally. We have moved from the infectious diseases where TB and HIV were priority, and we have seen that now non-communicable diseases are now a public health concern, which requires intentional targeted effort in order to address them. We have also seen that with the changes in climate, there is a number of climate-associated diseases and conditions, some of them vector-borne, which require us to be prepared to address them and respond. We cannot wait for things to get out of hand, but we'd rather be prepared. I think we have learned some key lessons from COVID that we need to be prepared for the worst in any situation. Thirdly, we also have realized globally that the gains of healthcare systems sometimes are affected by natural disasters or by wars that are happening, resulting in massive displacement of populations. But when populations are displaced, we need still to sustain health systems among these populations. There are children that need to be vaccinated, women that need to be checked on for their antenatal clinics. We have HIV patients that need to be getting their treatment. And so we need to start looking at how can we model sustainable approaches that can enable us to continue healthcare provision, even in the midst of displaced populations. So I think these are some of the things that I'll say we need to celebrate what we have achieved and still consider what we need to still do as we look forward into the future. Thank you.
Thank you. Very comprehensive. Definitely more than one message. And we needed to hear all of those three messages and more. Thank you for that. Beatriz, just coming to you, a key message from you, a call to action, for people who are wanting to create a better world, interested in global health. What's your key message?
I think I will echo some of Shami's sentiments on this. We still need support for infectious diseases. It's still there. Countries like Mozambique, like Ambassador Patrick was saying, have grown in population. So we're now with population growth, but we also have a very young population and a little bit of an old population. So all these non-communicable diseases like hypertension and diabetes is something we're seeing now, but we still also need some support for infectious diseases. So I think the call to action is to try to see how we can create some sort of transversal support that gathers support for all these cost-cutting areas in health. And like Shami said, taking into account climate change and how that affects negatively as well on health, and also not just to focus on donor countries, but also to look at the private sector and for-profit sector and how they can bring their expertise, their efficiencies, their novel ideas as well, and share with us and see what could be implemented to help improve healthcare in country. Thank you.
Thank you, Beatriz. Patrick, coming to you for the last word. What message would you like to leave us with listeners? Call to action. What would you like to convey?
Well, I think we've heard in the last 10 minutes or so some of the really big challenges that are faced. And certainly, if I look back from when you came here first in 1996, climate change has impacted further and further. And I've no doubt that Mozambique has responded with its own institutions in mitigation against many of the damages that was here and losses and diseases that can be associated with those effects. But there are more coming. We had El Niño most likely this year. I suppose, Nadine, to answer your question, the advantage of having had a period of time, baselines and benchmarks, but the simple message of health system strengthening It's slow, it's steady. People come and they go, maybe 2 years, 5-year postings, they don't see much change. But when you can accumulate that and have the stamina to continue doing that work over the 15, 20 to 25 years, I have absolutely no doubt that the investment pays off. But it's slow, it's steady, but I would sort of encourage stamina. There are things we're already doing well we shouldn't forget about. We have challenges ahead of it, but keeping some of the core work. And I think Ireland has been a staunch supporter of health system strengthening for many years. And I hope we'll continue to do so.
Thank you, each and every one of you, for really bringing alive the challenges, the needs, and kind of giving us the excitement about the possibilities for the future, and really listening to that message of slow and steady and focused, and also just by looking at you all here today, it's like the partnership, the importance of partnership. So thank you all. Really grateful.
Thank you.
Thank you.
And that brings us to the end of another enlightening episode of Better Health for a Better World. We hope you enjoyed our exploration of the remarkable global health projects and programs supported by the Government of Ireland. Remember, by investing in the health and well-being of communities around the globe, we not only create a better world for those in need, but also foster a more interconnected and compassionate planet. We encourage you to stay engaged and to take action, as each of us has the power to make a difference. Thank you for joining us on this journey towards better health for a better world.